Hello everyone, I am Abheek Roy and today I will talk about Hand Hygiene Day, which is basically a awareness raising campaign which is observed on 5th of May. The aim of this day is to raise awareness about the importance of hand hygiene in preventing the spread of infection and disease. The theme of this year's Hand Hygiene Day is Together We Can Accelerate Action to Prevent Infection and Antimicrobial Resistance in Healthcare and build a culture of safety and quality in which hand hygiene improvement will be given high priority. WHO established Hand Hygiene Day on 5th of May in honor of Ignaz Semmelweis' birthday, a Hungarian physician who is credited with pioneering antiseptic procedure in healthcare. He was one of the first doctors who recognized the importance of hand hygiene in preventing the spread of infection in hospital, and his works laid the foundation of modern infection control practices. Now question comes, why hand hygiene is important? There are certain reasons, and so some of the reasons are: first, germs are spread through touch. Whenever we go out, we come in contact of various contaminated items. So when the hand comes in contact with the contaminated items, the hand also gets contaminated. And when the individual touches the face, especially the eyes, the nose or the mouth with the dirty hand, the germs enters his or her body. To prevent this, an individual should frequently wash his hand with soap and water or sanitizer as well as possible. Another is germs can survive up to some hours or up to some days also. So due to this, the germs can pose a serious threat to the individual for spreading the infection. To prevent this condition, it's best to frequently wash the hand with soap and water and sanitize the hand. Another importance of hand hygiene is hand hygiene is critical in the is critical component in healthcare sector, especially the hospital, as because the healthcare workers come in contact with wide variety of patients, and in this environment it's very easy for transmission of germs or infection from one person to another. So good health practices is a crucial factor in preventing such situation. The basic principles of hand hygiene is, first, like when to wash your hand. Like you should wash your hand frequently after coming from bathroom, before and after eating, handling the garbage, and also after sneezing. Like when sneezing, use a tissue to cover the nose so that the germs don't spread out in the air. Or if you don't have the tissue, then you can use the inner elbow to cover your sneeze like this. Another is like how to wash your hands. Use soap and water. Like put your hand under the running water, running clean water, not just water, it should be clean water. Running clean water. Use the soap. Wash your hands like on the surface of the hands, behind the hands, between the fingers, below the nails for like 20 seconds. The hand washing steps, as you can see in the screen for better step-by-step information. Then rinse your hand thoroughly. Then dry your hands with the towel properly. In case if you can't wash your hands with soap and water, then use hand sanitizers with at least 60 to 70% alcohol content. Now the types of hand hygiene, that is first hand wash and hand sanitizer. Hand wash is the process where the washing of hand is through soap and water by continuously rubbing the hand in between the fingers, under the nails, on the palmar side, on the back side of the hand for like 20 seconds properly, and then rubbing and cleaning the hand with properly, and then rubbing it on that dry towel. But in case of hand sanitizer, it is used especially in cases when there is no facility of soap or water to clean the hand, and the hand sanitizer should be having at least 60 to 70% of alcohol content so that it can kill germs up to some extent. The most preferable method of hand washing is with soap and water, because the soap and water kills maximum germs and dirt from the hand, whereas on the other hand, the hand sanitizer may kill germs up to some extent, but it cannot remove the dirt from the hand, and the hand still stays up to some level of uncleaned. There are some mistakes while people when wash their hands, like they don't wash their hands properly, like they less than 20 seconds, they don't apply sufficient amount of soap, or they don't clean their hand after the soap solution under the clean water, or they don't dry their hands properly. So these mistakes should be kept in mind very carefully, and the hand should be washed, as I said before, with soap and water for like 20 seconds. If there is no such provisions of soap and water, then hand sanitizer on the go. Tips for maintaining good hand hygiene is: wash your hands at regular interval, avoid touching the eyes, face, nose, mouth with dirty hands, keep a sanitizer when you're going outside, and stay away from the dirt as well as possible, especially the contaminated surface. Be careful of what you touch outside, because in this environment lots of germs and bacteria that are present on every surfaces. So it's our duty to be aware of what we are touching, and even after touching items we should be careful that while eating or touching our face, we should properly clean our hand with sanitizer, or better option with soap and water. So this was my today's topic on this. I hope you find this informative. Thank you. Take care.